I'm Amy Richardson, and this is a study I conducted on the implications of mycobacterial disease surveillance on the health and welfare of freshwater aquarium fish. So mycobacteria are non-motile gram-positive bacilli that result in a highly infectious, chronic, progressive granulomatous disease. It is the most common global disease threat to freshwater aquarium fish and results in a high morbidity and mortality for these animals. Due to its long incubation period, which can range from 5 to 270 days, meaning that it can remain undetected for extended periods, and due to the fact that it presents with vague clinical signs, it is often only diagnosed when animals are dead or showing obvious skin lesions. Experimentally, we carried out a full body histopathology on representative samples from the management culls of the 4 species studied, which included Girardovnictis viviparus, Iliodon whitey, Amicus splendens, and Northobranchius sainthousei. These samples were used to estimate the true prevalence as well as the impact of mycobacteriosis. And management culls were used as these animals had no visible signs prior to euthanasia. Ziehl-Neelsen staining was used to detect acid-fast bacilli, which were morphologically diagnosed as mycobacteria, and disease severity was graded on a scale from minimal to marked. The image on this slide shows the kidneys of 4 Northobranchius sainthousei. A is minimal, B is mild, C is moderate, and D is marked. And you can see on the marked disease, the granulomatous lesions have almost entirely obliterated the parenchyma of the kidney. However, it's important to note that once again, this animal was swimming around with no signs of external disease. So this is a slide of one of the fish that I studied, and as you can see in the coelomic cavity, there's quite a high proportion of fat. There's food in the intestines, and you can also see that there's a fetus in the oviduct, so the fish is pregnant. And yet, when you look at the kidney, for example, there are these large granulomatous lesions running throughout the parenchyma and almost obliterating the parenchyma, and there's the same lesions in the liver. So despite the fact that there is this good body condition score, this relatively good proportion of fat, the fact that they are eating and reproducing normally, there is still this quite marked disease present internally. This graph shows the percentage of individuals per species with an overall severity of minimal to marked, with the overall severity determined by the highest severity organ per individual. In all 4 species, over 80% of individuals had some form of granulomatous disease, with all Northobranchius sainthousei affected. Iliodon whitey had the highest percentage of individuals with a disease severity of moderate or higher. This graph showed the percentage incidence of mycobacteriosis per species. Mycobacteriosis was found to be prevalent in all species that were studied, despite the lack of clinical signs. And Iliodon whitey, once again, had the highest disease prevalence with an incidence of 67%. In conclusion, mycobacteria is a very common, highly infectious disease. It's difficult to diagnose due to the minimal clinical signs, and moreover, it's difficult to treat and manage within an aquarium setting. It causes significant lesions that likely lead to pain, and this raises welfare concerns for what are often endangered populations. So what's the answer? Well, more proactive surveillance practices need to be implemented. And this may require a small proportion of individuals to be culled in order to give a more accurate overview of the population as a whole, rather than relying on those individuals that already have visible clinical signs or are already dead. This will then allow appropriate preventative techniques and treatments to be implemented, and this will improve the health and welfare of these fish. Thank you for listening to my presentation. I would also like to thank the various people who enabled this to happen at the Francis Crick Institute and the Zoological Society London, including my supervisor, Dr. Simon Spiro. And I would also like to thank the Royal Veterinary College for funding this project.